Runners, do you ever notice a deep ache deep in the buttocks area, runs down the side of the thigh, and even down the side of the shin at times? Perhaps you were told this was IT band syndrome or even sciatica, but did you know it can actually be referred pain from a muscle called the gluteus medius? Let's break that down in this video today. Now let's look at this chart. This is a referred pain chart. You can find them on the internet as well. But this is where the gluteus medius is. Remember, for referred pain is sometimes where pain is more present in the area that the muscle or the referring structure is not. So imagine a heart attack. Heart attack, most of the time the symptoms down the arm or the face, but it can feel some in the chest. So we have here more referred pain into the deep glute, the side of the thigh, and even down the side of the shin. The area of the side of the hip here can feel like a dull ache at times. It's hard to lay on. It'll seem like it's trochanteric bursitis. It may also be confused as IT band syndrome as it travels down the side of the thigh. Remember, true IT band syndrome is a friction syndrome at the side of the knee here that's noted with a painful clicking and popping. If you don't have that, you probably don't have IT band syndrome. And typically, IT band syndrome does not refer up the side of the thigh. This can either be this that we're looking at today, or it can be something like nerve root impingement or a sciatica. Notice the deep glute pain that people have as well. It feels like high sit bone pain. It'll feel like high hamstring tendinopathy. It may feel very deep, like you can't really touch it. So make sure you don't get confused and you're treating high hamstring tendinopathy when actually it could be more referred pain from the gluteus medius. And the last thing is down into the side of the shin. It can simulate types of knee pain like a fibular head injury or even tendinitis on the side of the shin which runs down into the ankle. I worked with someone just the other day on telehealth with this that they thought that they had IT band syndrome. And one of the dead giveaways is number one, there's no friction syndrome at the knee. And also two, they've been foam rolling the area and it's not getting any better, which you'd think it would. But if it's not, maybe we're missing the critical points. Maybe we're missing the root cause. If the glute medius is the culprit, we need to make sure we're treating appropriately. If you guys want to see another video on the glute medius, we have one in the corner, or if you want specific things that we do on our telehealth, just contact us. Our links are at the bottom of the video. Now you gotta wonder, why is this muscle becoming hyperactive? Why is it acting out and why is it referring? And the most common reason is overuse of that muscle. But you have to really rewind a little bit to figure out what that actually means. If it's overused and you have the same amount of mileage on both legs, then why would that one be like that and the other one on the other side not? Glute medius's job is primarily stabilization, but there are tons of other muscles of the hip that do stabilization as well. And if those ones are not working well, the glute medius will take over. It's very helpful. It'll become tight, it'll become fibrous, and it'll end up referring down as we mentioned in the picture. Now we have another video at the bottom which shows some of our favorite exercises for runners to combat things like this, but I'm going to show you a couple here today because we are in this video. So one of my favorites is going to be just simple clamshells, all right? Most people do clamshells poorly. The idea is to get large areas of the glute medius to work, and we can also supplement it by doing downside or stance leg closed chain work. And so I'm going to use this leg, but let's just say I'm trying to challenge this leg. We're going to take knees stacked originally, and most people do this poorly because they open up too far with their body. The knees should be stacked, and then you roll your body weight so you're really heavy on this one location of the knee. Bring this foot forward, and then we're going to wave at the camera with this one. When you start waving at the camera, what this does essentially is this will activate parts of this, which is the glute medius, but also it'll activate the glute maximus on the other side because it's having to do the support for the movement of the waving to the camera. Normally I have people do this for about a minute or so and they'll hate me at that point, and then we'll change sides. The other thing we can do is enhance pelvic stability for things like hip drop and so on. And a simple exercise is called a side plank. You've seen this probably a bunch. But now remember, this is, if we take my body here and you turn me up here, I'm essentially in single leg stance. So I'm trying to improve it, but from an exercise point of view. Other things that we're dialing up the activity on in a single leg stance, other than the glute medius, is going to be the obliques. And if you do fingers on sides and create pressure into your fingers, you're actually doing deep core activation. So the exercises should enhance your ability to tolerate forces in other areas that aren't working to help the glute medius relax. So if you've been dealing with IT band or sciatica or high hamstring tendinopathy and you feel like you're not getting anywhere, consider the glute medius muscle and consider the other things that should be doing the job that it's probably doing. Now, if you had an aha moment in this video, please give us a thanks. Scroll down at the bottom of the video on YouTube. On your phone or desktop, it's there. Click that, and then it keeps the lights on, it buys us coffee, and helps us know that we're making good content that you guys appreciate. Subscribe to the channel for more just like this.